and the celestic, which are available in different sizes. Each and every vacuum cup is connected with its own tubing to be attached to the vacuum machine. Or this is the vacuum suction machine, which has got a pressure gauge on it attached to it, and it has got a tubing. This pressure gauge is used to assess the pressure which is required to build for the successful vaginal delivery. If you just come close to this gauge, this has got different pressure. For successful vacuum vaginal delivery, the pressure must be built up to 400 mm of mercury, or 0.8 per kg meter centimeter square. This tubing at one end is attached to the tubings of the vacuum cup, and the other tap is attached to the suction bottom. Before application of the vacuum cup to the fetal head, it is of utmost importance that the vacuum suction must be checked whether it's working or not, and it is done by applying it to the palm of your hand. Now ask the assistant to turn on the machine. When the pressure reaches the 400 mm of mercury, start pulling the cup. If it remains attached to this at this pressure, that means the vacuum cup is working. Now ask your assistant to turn it off. Before applying the vacuum cup on the fetal head, we must understand the anatomy of the fetal head: anterior frontanelle and posterior frontanelle. This area, posterior frontanelle, and 2 to 3 centimeters anterior to that area is called the flexion point. The vacuum cup must be applied at this point, including the posterior frontanelle. Because if we apply the cup anterior to this point, it would rather cause the extension of the fetal head rather than producing the flexion. But if we apply the cup over here, this area, the traction on this vacuum cup will produce the flexion of the baby head rather than extension. Similarly, if we apply the baby head moves posteriorly with the cup on the head, it will not produce the required flexion of the baby head. Before application of the vacuum cup to the fetal head, an obstetrician must be able to fulfill the whole prerequisite criteria. That is, the horse is fully dilated, the head is in the occipital transverse or occipital anterior or posterior position. The obstetrician must be able to recognize the posterior frontanelle, which is triangular in shape, which at some time in obstructed labor due to edema might be a little difficult to felt. With the left hand 2 fingers, we separate the labia apart, and with the right hand we place the vacuum cup on the flexion point of the fetal head. Then keep these 2 fingers of the left hand on the fetal head and the thumb of the left hand on the fetal cup. These fingers will help the cup kept applied to the fetal head and to assist in the flexion of the fetal head. With this finger, just sweep this all around the vacuum cup so that there is no intervening vaginal tissue between the vacuum cup and the fetal head. Now ask your assistant to build up the pressure. Now wait till the pressure reaches the 400 mm of mercury, and wait till the patients start having contractions. You should not apply traction on the fetal, this vacuum cup, until and unless the patient is having contractions. When the required pressure is reached and the patient starts having contractions, start pulling the vacuum cup in the line of pelvic axis, which is initially downward and posteriorly. At the time of crowning, the direction is changed from posterior and downward to anterior and upward to assist the baby head to deliver. When the baby head is delivered, Ask the assistant to turn off the vacuum machine, and the baby head is delivered, followed by the delivery of the baby body.